Hello everyone, today we are going to talk about benign prostatic hyperplasia. Did your father or relative ever had difficulties passing urine or urinary incontinence? Have you ever heard of benign prostatic hyperplasia, BPH? So BPH is also called prostate gland enlargement. It's a common condition that affects men when getting older. It can also cause bladder, urinary tract, or kidney problems. In this video, we'll talk in details about this common disease, its symptoms, how it is diagnosed, how it can be distinguished from prostate cancer, and finally, how it can be treated. Our role today is to answer most of the questions regarding benign prostatic hyperplasia. Today we have Doctor Yoon, who is a leading doctor at Stantop Clinic. He is going to discuss with us everything about BPH from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases.
안녕하세요.
Hello, Dr. Yoon. So can you introduce yourself to us?
I'm Yoon Jang-ho, a neurologist at Stantop Clinic. Nice to meet you.
반갑습니다.
Okay, so for our first question, what is actually BPH and what are the types of BPH?
BPH is a disease also called benign prostate asymmetry. BPH is a symptom of an enlarged prostate. It does not appear in women, but only in men. It is called prostate in Chinese characters, meaning standing in front of the bladder. The prostate tends to grow with age, and this symptom is also associated with eating habits. It can be seen that BPH patients and their degree are larger in countries that consume a lot of animal fat or dairy products. Above all, genetic factors should also be considered.
Okay, so are there any side effects when patients don't treat BPH?
In the case of BPH, it may not be a life-threatening disease. However, people urinate 5 to 6 times a day, and some people do more than 20 times a day. Therefore, if you are a person who urinates several times a day and has to pay too much attention whenever you urinate, the quality of life decreases a lot when you have BPH disease. If not treated, there are cases where you die after not urinating for 2 to 3 days. And if not treated, the severity of the disease varies from very weak to severe, from the degree to which life is uncomfortable to the extent of death. It is life-threatening. In the past, when there were not many hospitals in Korea, elderly people living in the countryside died after not being able to urinate for 2 to 3 days. But now they do not die of BPH because there are many hospitals and treatment is available. However, these days, as the average age increases, more and more people suffer from discomfort in life due to BPH. There are daily inconveniences such as coming out weak when urinating or not feeling refreshed after urinating. And because this symptom is not treated, people often come to the hospital later due to urination too often, inability to hold urine or night urination at night while sleeping. Because I can't sleep properly at night due to urine. The discomfort of living a normal daily life the next day often increases.
Okay, so what are the methods to diagnose BPH and what are the treatments available for it?
When diagnosing BPH and deciding how to treat it, it is important to check how big the prostate is. Prostate size cannot be measured with the naked eye through a patient's weight or height. But there is a way to touch it directly by putting a finger into the anus called a digital rectal examination, DRE. And to measure the exact size, the size is measured through prostate ultrasound. In addition, to its size, it is also possible to measure how much the enlarged prostate affects the urine rate. It could be said that what patients are most worried about is prostate cancer, and it is most important to judge it. Blood tests can also be conducted to confirm the association between BPH and prostate cancer. And these 3 methods are very important. To put it simply, treatment can be divided into drug treatment, procedure, and surgery. When you first come to the hospital with BPH, you can check for some symptom relief with medication. However, if the treatment is late, has a family history, or has severe symptoms, they often do not respond to drug treatment and have to perform procedures or surgery.
So is BPH related to prostatitis?
One of the most distinct diseases from BPH is prostate inflammation. In fact, these two diseases can be considered separately, but most of them have prostate inflammation if BPH is severe. This is because when the prostate is enlarged, blood supply is not smooth throughout the prostate. And as a result, the discharge of the insular fluid or semen in the prostate is not smooth. In addition, if urine discharge is not smooth due to prostate hypertrophy, you will use a lot of force when urinating, and you will urinate forcibly. So urination may flow back to the prostate tissue finally, causing prostate inflammation. Therefore, these two are separate diseases, but they can be said to be symptoms that appear together.
So for our last question, are there any prevention of BPH?
Patients often ask how to prevent BPH. Prevention is not special. Since it is a disease that occurs with age, it is important to recognize that it is a disease that can come to anyone and to have regular checkups. In addition, if you feel any uncomfortable symptoms when urinating, it is best to get appropriate treatment. Treatment of BPH includes surgery and medical treatment along with medication. Existing surgery is a surgical method in which the enlarged prostate tissue is cut off with an electric knife or laser to remove it. However, in this case, there is a possibility of bleeding because the tissue must be cut off, a possibility of reverse ejaculation that men are worried about, and there is a possibility of urinary incontinence. There is also a disadvantage that the ejaculation does not erupt front in the future because the tissue that should be normally present is cut off. The fact that things can't be done in the future means that things will be done later. When men have sex, they feel orgasm while making ejaculation, but because they can't erupt ejaculation, they cannot feel orgasm. Therefore, patients who worry or hesitate to perform BPH surgery are worried for this reason, and many people regret it for the rest of their lives after undergoing surgery because of this. Therefore, the reason why patients postpone surgery or insist on medication, even through drug treatment, has become useless because of this problem. However, in our clinic, there are procedures other than surgery. We proceed with the procedure of inserting a prostate ligation, which is a method of performing surgery differently from the conventional surgical method of cutting tissue. It is a procedure in which threads are inserted into a narrow hole and pulled to both sides, rather than cutting tissue. That's why it makes the hole through which urine passes wide. Therefore, the possibility of bleeding, retrograde circumstances, urinary incontinence, etc., which have been disadvantages of existing surgery, is significantly reduced or does not occur. Therefore, relatively young age patients and early symptom patients can see symptom improvement through these simple procedures.
So thank you so much, Dr. Yoon, for answering our questions today. Thank you so much.
Thank you.
Today we learned many things about BPH, and the doctor explained in details everything related to this common disease, such as its symptoms and how it can be diagnosed and treated. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as we can.